Today I'll be discussing on histamine and antihistaminic drug. So without wasting time, let's move in. Generally, when you hear the word autocoids, what are autocoids? The word auto means self. Acos means healing substance or remedy. Therefore, autocoids are drugs that are compounds or neurotransmitters or hormones that are produced by an organ and act on that organ or any other organ or structure close to it. So we can also call them local hormones. So they are local hormones. An example of an autocoid is where we have histamine. Histamine is an autocoid. Not the only example of autocoids that we have. We have different type of autocoids as you can see there. We have amine autocoids, that's where you have histamine and serotonin. We have lipid autocoids, that's where we have prostaglandin, leukotriene, platelet activating factor. Then we have peptide autocoids like plasma kinase and angiotensin. These are the examples of autocoids that we have. Now, when you talk about histamine, let's move on to histamine proper. Histamine is actually taken from two words there, two terms. Hista, which means from the word histology, tissues. So histo have to do with tissue. Then amine. So histamine simply means the amines that we get from tissues. So histamine can simply mean tissue amines. Histamines that are gotten from tissues. They are gotten from animals a whole lot, abundant in animal tissues, but there are some plant tissues that have histamine. An example of that is the stinging nettle. Stinging nettle is an example of a plant that has histamine. All right, histamine plays a whole lot of physiological role, and primarily its primary site is the mast cells. Mast cells actually contain granules, and those granules contain a whole lot of what? A whole lot of histamine. Very good. They also found in other regions apart from mast cells. You can see them in the skin, in the intestine, in the gastric mucosa, in the lung, in the liver, the placenta. These are various sites of histamine. But remember, the primary site of histamine is the mast cells. They are also found in the central nervous system where they can serve as neurotransmitters. We said you can see them in the stomach. Yes, they are secreted there in the stomach. Some snake poisoning actually secrete histamine. So these are locations where you can see histamine. Let's now talk about the synthesis and the storage and release of histamine. Histamine is synthesized from an amino acid called histidine. So histidine is the amino acid that actually form histamine. The enzyme that helps to convert histidine to histamine is referred to as L-histidine decarboxylase. L-histidine decarboxylase. So L-histidine decarboxylase helps to convert histidine to histamine. After histamine is being formed, let's now talk a little about how it is being metabolized, how it is being broken down. It is metabolized by two pathways. By two pathways. You've heard of cytochrome P450, which we already explained in our biotransformation topics. Yeah, we talked about cytochrome P450 a lot in that topic, biotransformation. So the enzyme called cytochrome P450 actually plays a role. That system plays a role also in the biotransformation or metabolism of histamine. Okay, first thing first, histamine undergoes what we refer to as methylation reaction. That's one of the pathway involved. There are two pathways involved. One of them is methylation reaction. Methylation is an example of conjugation reaction where a methyl group is added to a compound. So adding methyl group to histamine now gives rise to N-methylhistamine. Yes, the name of the enzyme that helps to add methyl group to histamine is N-methyltransferase. You get all right, and to N-methyl-imidazoacetic acid. So those two things are formed. Methylation to form N-methylhistamine and N-methyl-imidazoacetic acid, which are eliminated in urine. Can also be taken away by oxidative deamination. Another pathway is oxidative. So the two pathways what? Methylation and oxidative deamination. In oxidative deamination, it is to undergo oxidative deamination to form imidazoacetic acid. Hmm? Imidazoacetic acid. And also it also give form imidazoacetic acid riboside. And they are also removed via urine. So the two pathway of metabolism, we know the synthesis, metabolism, how it is being converted to Is form in which it can be removed from the body. Mhm. Include methylation and oxidative deamination. Then they are excreted in form of urine. So histamine is positively charged, and if it wants to be stored within the mast cell, it needs to bind to something that is negatively charged within that mast cell. And what it binds to is what we refer to as acidic protein. It also binds to heparin. Heparin is negatively charged. So they are negatively charged and it binds to this histamine that is positively charged to keep it in place. It is ineffective to give heparin orally. This is because the liver destroys it. Do you get? The liver destroys all absorbed form of heparin, so you don't give it orally. Now let's move on to the histamine receptor. Histamine has different receptors, H1, H2, and H3. H1 receptor, H2 receptor, and H3 receptor are located in various areas. So if you check this table, you can actually find that out. Now, any drug that can bind to H1 receptor and stimulate H1 receptor as if it is epinephrine, as if it is histamine that is binding to it, is what we refer to as H1 agonist. Then anything that can bind to H1 receptor and block it so that histamine cannot bind to H1 receptor is referred to as H1 antagonist. Same for H2 and H3. Selective H1 agonist, things that can bind to H1 receptor and work as if it is histamine that is working, include 2-methyl-histamine. For H2 receptor agonist, we have 4-methyl-histamine. For H3 receptor agonist, we have alpha-methyl-histamine. What about the antagonist? What binds to the receptor and actually block it as if and does not allow histamine to bind? That's where we have for H1, selective H1 antagonist, where we have meperamine. Selective H2 antagonist is where we have cimetidine and ranitidine. Then selective H3 antagonist is where we have thioperamide. All right, so that's that for that. Just be specific. Just know the following: that H1 receptor is majorly located in smooth muscles of the intestines, of the uterus, and of blood vessels. Some blood vessels. H2 receptor is primarily located in the gastric gland, and that's why it is important when talking about treating peptic ulcer. I'll talk about that as we are going. Then H3 receptor is located in the brain. There are other locations, but just taking of these ones. All right, so now we can now move on to what we refer to as the releasing agent. Releasing agent simply means what are the things that we allow histamine to be released. Remember, its primary location is within the mast cells, so there are some things that can cause it to be released. Some of things are immunoglobulin mediated releasers. The immunoglobulin related, they are related to immunoglobulin, those things that are immunogenic. Then others are non-immune releasers. So we have immune and non-immune releasers. Immune releasers are the ones that we mention as immunoglobulin mediated. When we are discussing about asthma, you can go and check our material on asthma, tutorials on asthma. We already mentioned that asthma is an example of type 1 hypersensitivity reaction, and it actually is mediated via immunoglobulin E. Very good, via immunoglobulin E. So anything that can cause immunoglobulin E release can actually cause mast cells to release histamine. Do you get now? All right, so those things are what are listed here. Then the others are the non-immune releasers. Do you get? So you should know the immune and the non-immune releasers. All right. After this slide, now let's now move on to this important slide, the pharmacological action of histamine. Very important. I'm trying to make the tutorials fast so that you can get the points in a very short time. This slide is important. Pharmacological action of histamine. Histamine has different pharmacological action. So we're talking about different regions in the blood vessels. Remember I said in the blood vessels, the smooth muscles of blood vessels, you majorly see H1. Is that not true? Yes, primarily H1. Now when you give somebody histamine, what will it do to the blood vessels? For smaller blood vessels, it will cause vasodilation. But for large blood vessels, it will cause vasoconstriction. So take note of that. For blood vessels, for smaller blood vessels, it will cause vasodilation. Smaller blood vessels include arterioles, veins, venous, and capillaries. They are smaller blood vessels. It will cause what now? Vasodilation. This is actually mediated primarily by H1 receptor. Then If, for example, you give it subcutaneously, for example, just subcut, what will happen? There will be flushing. That region, for example, will be red. Do you get now? It can cause heat. So all of that can result. But just to cause vasodilation for small blood vessels, then for large blood vessels, it causes what? It causes vasoconstriction. It can also increase the permeability of blood vessels. Can increase the permeability of capillary blood vessels. Okay, now let's talk about the triple response of histamine. What's the triple response of histamine? If you give histamine subdermally below the dermis, what will you see? One, you are going to see what we refer to as red spots. Red spots you see within few seconds. What causes this red spot? It is vasodilation. Remember, for small blood vessels, it causes vasodilation. This is mediated by H1. Also, you are going to see what we refer to as flare. Flare is different from red spot in the sense that it is beyond 1 centimeter. Red spot is just 1 millimeter, but flare is beyond 1 centimeter. Flare is also mediated by H1 receptor. Then after that, the next thing you are going to see is what we refer to as wheal. Wheal simply involves edema, which is collection of fluid within that area where you find red spots. So initially you find red spots. With spots is just one particular spot. Within that area, you are not going to see edema, collection of fluid within that area of the skin. Small collection of fluid. Do you get? And that is due to what we refer to as increase in capillary permeability. Remember we said histamine causes permeability. The capillary become more permeable. Do you get now? So fluid can easily pass through the capillary and now form a form of edema under the skin. These three things that you see if histamine is given subdermally is what we refer to as the triple response of histamine. They include red spots, 1, 2, flare, and number 3, wheal. We are through with that. What about the pharmacological action in the heart? In the heart, histamine is going to cause increase in cardiac contractility. It also causes increase in electrical activity. It can increase the force of contraction of the heart by allowing calcium ion to enter into the muscles of the heart so that they can contract. Do you get now? It can also increase the flow of blood through blood vessels. However, it decreases atrioventricular conduction. You know the SA node, AV node, Purkinje fibers, that's the conductive system of the heart. Yes, what histamine does is that it slows atrioventricular conduction. But all other things like atomicity is being increased. Chronotropic effect of the heart is being increased. This is the effect of histamine on the heart. Overall, it decreases atrioventricular conduction, it increases chronotropic effects, and also increase atomicity. Let's continue with the pharmacological action. Histamine within the respiratory tract, when it's out on the smooth muscles of the bronchi, it causes bronchial constriction. It is one of the primary mediators of constriction in bronchial asthma. When you go to the intestines, it causes intestinal contraction of the smooth muscles of the intestine, but it does not have any effect on the smooth muscles of the uterus. The uterus is not affected by histamine. Do you get that point? Very good. When you come to the gastric gland, let's go to the stomach. In the gastric gland, what is the effect of histamine? Generally, histamine, there's what we refer to as hydrochloric acid. The acid found in the stomach, which makes the stomach acidic. It is formed by H, that's hydrogen ion, and the Cl, that's chloride. When they come together, they form hydrochloric acid. Now there's a pump. This pump is what we call the proton pump. The proton pump is what takes hydrogen into that hydrogen ion so that chlorine can bind to it. Do you get now? That proton pump is activated by histamine. So histamine allow more acid to be formed, more HCl to be formed in the stomach. Now imagine somebody that have what we refer to as peptic ulcer. In peptic ulcer, there's already what's now increase in acidity. There's the acidity there is already much because there's an erosion of the mucosa of the stomach. Already there's an erosion of the mucosa of the stomach. Apart from that erosion, you are now forming more acids. What are you doing to this person? You are actually causing more problem for this individual. So histamine increase the formation of acid by activating that what pump, which we refer to as the proton pump. So it's a proton pump activator. That's why histamine antagonists can be used to treat peptic ulcer. So we'll talk about that as we are going. So just take note of that. When it comes to sensory nerve ending, it actually causes itching. Histamine is one of the most common things implicated for allergic reactions, and that's why antihistamine can be used to treat allergic reactions. It does not cross the blood-brain barrier, but once you actually put histamine directly into the brain, it can cause increase in BP, it can cause cardiac stimulation, it can cause vomiting. All right. Now let's not talk about the role it plays. This one is very easy. In the gastric, we've already seen what it does. Allergic reaction, we've seen the response for allergy. It can cause urticaria. I'll show you a picture of urticaria. It can cause allergy. It's in the brain. It's a neurotransmitter. It's an example of an excitatory neurotransmitter. All of these are the normal things we've checked already. So now we are through with that. Let's now move on to what we refer to as histamine antagonists.